Well, my training background is in hospital medicine and in general practice, but I'm a career homeopath, which means that I am a full-time medical homeopath. That's how I spend my working day, my working week. I think when you train in medicine, there are a lot of pressures to use some very evolved guidelines, protocols for treatment. And many of these have been worked out very carefully and are very well developed, but many of them are orientated towards patient management. And I think there's quite a difference between managing a problem and helping somebody to change. Homeopathy is fundamentally about change. It's about facilitating change. And protocols, guidelines for illness management have their place within medicine, but sometimes they're not enough. Caring empathic practitioners always go a bit deeper, no matter what discipline they're in. But the fact is that as a homeopath, we use that depth, who the patient is and why they're unwell, what they feel, what they experience and how they react. The intrinsic dynamics of their symptoms becomes therapeutically relevant in a way that it may not be relevant in orthodox medicine. So that provides us with a layer of creativity for what we do, and it means that every day is different, every exploration with a patient is different and requires a flexibility of approach, and that is very exciting. It's very liberating for a doctor. It helps individual healthcare professionals to avoid becoming institutionalized. We avoid becoming jaded because there's always an additional creative dimension to what we do.